Very good morning to everyone. We now diverge into a topic that's quite different from the usual clinical topics that occupy this space. And I'll be talking about steps for doing a systematic review in the context of a thesis review of literature. And while this may seem quite esoteric to most of the people here, let me convince you that this actually pertains to all of us in some way or the other. So let me begin by making a case for why you should bother learning about systematic reviews, and there may actually be a number of reasons. Well, first of all, if you have a clinical question or a research question, a systematic review gives you a very good summary of the body of evidence on that clinical question. So in order to understand the complete body of evidence on a clinical question is the perfect place to go to. But from the practical standpoint, if you want publications, it turns out journals actually love publishing systematic reviews because they're cited more often, so it increases the impact factor of the journal, which in turn also increases your citation index and thus the institute's citations. And it's a study design that does not require any funding or any ethics clearance. So it's something you can just do sitting on your laptop. There are other reasons. For example, the way that clinical practice guidelines are formulated, they actually stem from a systematic review of the evidence. So there's an approach called the GRADE approach, which utilizes a systematic review to formulate recommendations in clinical practice guidelines. Also, if you're writing a research proposal, a systematic review could considerably strengthen your proposal, and a lot of agencies across the world actually require it as part of your thesis proposal. But today, the reason I'm here to talk to you about systematic reviews is in the context of a thesis review of literature. And all the residents here are required to do a review of literature for their thesis. And I recommend do it in the form of a systematic review. Apart from being one more publication, it's a more useful form of a review of literature. So in the context of a thesis review of literature, a systematic review can actually be thought of as being an integral part of the research cycle. So a literature review, we all know, it has value in summarizing what is known about the topic, determining the certainty with which we know it, and to find gaps. And a systematic review is basically a scientific method to conduct a review of literature. It achieves all of these motives and does it with systematic strategies for searching, selecting, and synthesizing the evidence. So what differentiates a systematic review from a traditional review? So the way it's been done traditionally is a narrative review. And it differs in the sense that, as I said before, it contains systematic strategies to select, search, synthesize the evidence. So with regard to the clinical question, you would agree that a narrative review is more general. So when you talk about traditional or narrative reviews, very often they will cover all components of a disease. So they will cover diagnosis part, treatment part, describe symptomatology, etc., etc. Whereas a systematic review is very focused. So it always addresses a focused research question. And I'll tell you how to formulate that question in a little while. Also, the steps for searching, selecting, appraisal, and synthesis is specified in a systematic review. While we don't know exactly in a narrative review how the authors came about achieving at the studies that they've included in their review, we don't know how they came about selecting those studies, and we don't know about the quality of those studies. So the critical appraisal of those studies is very often not described in the narrative review. In a systematic review, all of these steps are explicitly reported. So the search strategy is explicitly reported. How we selected those studies is reported, and quite a considerable amount of effort is expended on assessing the methodological quality of those included studies. Also, synthesis in terms of statistically combining the results of the included studies is very often not there in a narrative review, whereas it may or may not be a part of a systematic review, but it's commonly done. and that is called a meta-analysis. So if you're starting your thesis and you have a number of research questions, or maybe one research question, you may be wondering what kind of studies are amenable to being included in a systematic review. And the answer is pretty much any kind of study. So no matter what your thesis topic, you can do a systematic review for it. So you can do a systematic review for prevalence or incidence studies, diagnostic test studies, observational studies, prognosis etiology studies, or interventions, of course, RCTs. And Dr. Chandni just described a number of different meta-analysis in her talk, which were all including RCTs. If you're a basic scientist, again, there are a number of systematic reviews in basic science. And while narrative reviews are still kind of the norm in basic science, but I will tell you reasons to do a systematic review if you're a basic scientist as well. So what are the steps in conducting a systematic review? Well, we always start out with a well-defined research question. So it's not general, it's very specific, and it has specific components, which I'll talk about in the next slide. We must write a protocol before we embark on conducting a systematic review, which includes the inclusion criteria for the studies. We then go on about our literature search, and I'll tell you where to look for studies, but that's the next step. Following that, the selection and the abstraction of data, this is all done in duplicate by 2 reviewers. So the minimum number of people you require to do a systematic review is 2. You need at least 2 people. The selection of the literature is done in 2 steps. The first step is the title and abstract screening, and those that are found eligible in the title and abstract screening go on to do the full text screening. You then abstract data and you do methodological quality assessment of the studies. That's called the risk of bias assessment. And all of these steps constitute the systematic review. In the end, if it makes sense, you can synthesize the results statistically. So you can combine the results statistically, and that's called the meta-analysis. Very often, it may not make sense to do a meta-analysis. For example, in basic science, you have evidence from cell lines and animal models and omics studies, etc., etc. It may not be possible to do a meta-analysis, but you can go ahead and do it if it makes sense. And there are criteria that will tell you whether it makes sense or not. So a systematic review may or may not include a meta-analysis. However, you have to do all of these due diligence steps that I just described in the previous slide. So unless you've done all of this due diligence, it doesn't really make sense to just go ahead and combine the results of those studies. So a systematic review may or may not contain a meta-analysis, but a meta-analysis without all of those steps is not very meaningful. And of course, you may be familiar with this plot. The results of the synthesis part, so when you mathematically combine the results, that's called the meta-analysis, and it's depicted in the form of a forest plot. Let me just take you quickly through the components. Over here in the first column, you have the names of the authors, which is also very often accompanied by the year. Here, you have the graphical representation of the results of the individual studies. So this point in the middle is called the point estimate. And this is kind of like the best guess from the data. And this horizontal line is the confidence interval. So this is the whole range of plausible values consistent with the data. So that's there for every individual study. And then in the end, you have this diamond. And this is the actual result from the meta-analysis. So the center of the diamond is the point estimate from the meta-analysis, and the two ends of the diamond are the confidence intervals. You have different boxes here, and the area of the box represents the weight of the study. So different studies are assigned different weights, and I'll tell you what the weight depends on. But the next column represents exactly these estimates that are depicted here. So you can see your 1.04 is the point estimate, and 0.48 to 2.28 is the confidence interval, which is depicted by the horizontal line. And then this is the pooled estimate. And then the last column represents the weight allotted to each study. So how do you formulate your research question for a systematic review? And there are components which are depicted by the acronym PICO. So P stands for population or patients of interest, I for intervention. Very often we are not including interventional studies, so we have only exposure. So then in that case it would be PECO. C stands for comparator and O for outcome. So this is how you formulate your research question. To give you an example, this is actually Dr. Rakhi's question. Does albumin reduce mortality in patients with ascites due to liver cirrhosis? The population of interest here is patients with ascites due to cirrhosis. Intervention is albumin. Comparator is no albumin or care without the use of albumin. And the outcome is overall mortality. To take another example, what Dr. Chandni described just a few minutes back, albumin and SBP. So there, that meta-analysis, the PICO question was SBP. The intervention was albumin. Comparator was no albumin. And the outcome was, again, overall mortality. So we don't shy away from keeping mortality as an outcome for a systematic review, because while individual trials may not be powered enough to detect a mortality signal, the point of doing the meta-analysis is to increase power. So we may actually have enough numbers in the meta-analysis to detect the mortality signal. Any questions so far? Okay, so this is exactly what...
Yes, one question is the heterogeneity and the bias.
I'll just come to that.
Come to
Yeah.
Okay.
What
So-
is the weight?
Again, I'm coming to that. So again, the two very pertinent questions is what does the weight depend on, and what do we do about heterogeneity? And I'll tell you what heterogeneity is first of all and what to do about it. But we're still on the first step, which is formulation of research question. And the inclusion criteria for the studies in our systematic review is formed by PICO, so the population intervention comparator outcome, and the study design. So you have to specify what kind of studies you will include. Is it just RCTs? Is it RCTs and cohort studies? Is it RCTs, cohort studies, and case series? So you have to specify that. Once you've written your protocol, you must register it. Now, it's not like a trial where you have to register in order to publish, but now editors and reviewers ask whether you've published your protocol for the systematic review. And this is the place to do it. There's a website called Prospero. So if you're somebody who's going to embark on doing the literature review for their thesis, write the protocol and register it on Prospero. And you have to specify all of these different things. So the research question, the search methods that you will employ, the criteria for including, excluding a study, which I told you comprises of PICO question and study design, the criteria for quality assessment, methods for data extraction and synthesis, and if you intend on doing any subgroup analysis, you must pre-specify this in the protocol. It must be a part of your protocol. If you're doing a Cochrane, if you're writing a Cochrane review, then they actually have their own database. So that's the Cochrane library. Now, coming on to the next step. So now you've written your research question, you know what you're doing your thesis on. You decide, okay, I'm going to do a systematic review for my literature review. And you've written your protocol and you've registered it in Prospero, okay? So now you're actually beginning to do your systematic review, right? And the first step is to search for literature. And where do you search? Well, the most intuitive answer to that is, of course, electronic databases. Everybody knows about Medline. The website to search Medline is called PubMed. So that's the first place that anybody goes to in order to find biomedical literature. And that actually comprises one of the main electronic databases to go through. But what is recommended is that you cover at least two major databases. So apart from Medline, one of these. So Embase is another major one. It's paid. And there's Cochrane Library, there's CINAHL, Google Scholar, etc. So cover at least two of these major databases. Apart from this, also do hand searching. So you have to look through the reference lists of included studies, maybe go to an expert who may have a trial lying around in his file drawer but does not find the incentive in publishing it, or an expert who may know about a student's thesis that is unpublished. So make some attempt to capture unpublished literature in your systematic review search. Also, you have to search clinical trials registries. So clinicaltrials.gov and CTRI, they are two places that you must search, because that will give you an idea of if there are any unpublished trials. So if something's registered but it's not published, you want to be able to capture that as well. And talk to experts. Now, when I had first started, being a part of an international group that writes systematic reviews, what was most surprising to me was that in order to do the literature search, they actually have a librarian on their team. So they call them information specialists. They are PhDs in medical informatics, etc. And let me show you a search strategy that was devised by an information specialist. It's actually a work of art in order to devise an effective search strategy that is sensitive, because the point here is that we don't want to miss any study. So they are actually experts in devising very, very strong search strategies for each database. They customize it for each database. And this is just here to scare you because, it's a very difficult thing to devise a very sensitive search strategy. Now, here in India, of course, we don't have librarians that are trained in making search strategies. So we have to do it by ourselves. But what is recommended is that you have an information specialist on your team when you're writing a systematic review. And a lot of good journals actually ask if you took the help of an information specialist. They are basically librarians. So most likely, if you're in India, you'll have to take you'll have to take help from somebody who's in the US or Europe, or you'll have to develop those skills by yourself. Why do we search different databases? This is just a comparison of two different databases. You can see here Medline and Embase, they have an overlap of only approximately 40%. So that's why we require that at least two be covered. I'll move on quickly. The PRISMA guidelines are the reporting guidelines for systematic reviews. And this is the first figure that appears in any publication, systematic review publication, which depicts your search. How did you screen? So the first one is, how many records did you retrieve? Then how many did you retrieve for full text screening, and how many were ultimately included, along with the reasons for exclusion for full text screening. So this has to be described, which is why you have softwares, and I'll name the softwares later on, that can help you with the screening process. So they will actually produce this diagram for you if you haven't been able to document the results in an Excel file or something else. Data extraction is actually exactly like your traditional review of literature. So you make that table with the characteristics of included studies, with characteristics for patients, intervention in terms of dose, route, etc., and the outcomes. But this has to be done by two reviewers in duplicate. So two people have to do it in duplicate, and then consensus has to be reached by either discussion or by referring to a third reviewer. Risk of bias assessment is basically pertaining to the quality of the included studies with regard to methodology. So how strong was the methodological quality of the included studies? Because there's a phenomenon called garbage in equals garbage out, which means that if what you're including in your systematic review is biased studies, then what it will churn out is also a biased estimate if you do a meta-analysis, or it's only as good as the included studies. So which is why you must assess the methodological quality of the included studies. For a trial, this is just an example of a systematic review that's done, risk of bias assessment for trials. This is the Cochrane risk of bias tool. These issues, some of them I will discuss next week when I talk about reporting guidelines for randomized controlled trials and what these issues pertain to. But no matter what kind of study design you're including, be it a randomized controlled trial or an observational study like a cohort study, you must do risk of bias assessment. So this is an example of one done for a cohort study. Similarly, you have one for case series also. Reproducibility is pertinent because two people have to do it in duplicate. So there has to be high agreement, and very often the agreement is documented also. There's a statistic called the kappa statistic, which tells you the inter-rater agreement between the two reviewers. Because very often assessment and data abstraction is subjective. Now, the final synthesis, which will actually cover both of the questions that were asked, the actual combining, you could say the most glamorous part of the systematic review is the synthesis or the meta-analysis. And let me ask you a question. If a class has 200 boys and 100 girls, and the average weight of the boys is 70 kgs and the average weight of the girls is 40 kgs, what is the average weight of students in the class? So I can do 70 plus 40 divided by 2. That's 110 divided by 2, 55. Why? Yeah, so everybody got it correct. It's actually 60 because the number of boys and girls is different. So here there are 200 boys and 100 girls, which is why you can't just simply take an average. You have to take a weighted average. So you have to give appropriate weight to boys and girls while taking out the average, and that's the weighted average, and which is why you got 60. So you're actually giving a weight here. So while a meta-analysis may seem like a very technical thing, the concept is actually very simple. It's nothing but taking out a weighted average of the results from individual studies. So you can see here, this is a simulation. It's not an actual meta-analysis. It's included 2 studies. Study 1 has a total of 200, so 100 each in each arm, and study 2 has 200 each. So you can see here that the weight allotted to study 2 is double. It's 66%. Even though the effect that they're showing is the same. So they've both shown a 50% reduction in the outcome. You can see a 0.5 risk ratio. But the weight allotted is different because study 2 has twice the number of participants compared to study 1. So the first thing that the weight depends on is the sample size. Okay, that's the first thing. It's not the only thing it depends on, but that's the first thing it depends on, the sample size. And the more the sample size, the more the weight assigned to the study. Over here, let me ask you another question. Weight reduction, this is the question that these 2 studies were trying to answer. Whether weight reduction decreases risk of myocardial infarction amongst obese individuals over a 7-year period. And there are 2 studies that were done on this question. The study 1 had, so they both have the same sample size, 2,000 participants in each trial. And the effect is also the same. So study 1 had 1,000 and 1,000 in the experimental and control, gave the same intervention, weight reduction. There was 1 event, so 1 myocardial infarction in the experimental group and 2 in the control group. Study 2 had 50 events in the experimental group and 100 events in the control group. So the sample size is the same and the effect is also the same. It's reducing by half. So, but which according to you deserves more weight? Yes, exactly. So study 2, you would agree, deserves more weight despite having the same sample size because they have more number of events, right? Why this is important is because if 1 event goes up here in this study, then this becomes the same, 2 events each. Whereas in study 2, even if you increase it by 2, 3, 10, 20 events, the conclusion of the trial remains the same. So this is called fragility of a trial. Fragility of a trial refers to how many events changes the conclusion of the given trial. And for study 2, this is, of course, this result is way less fragile than study 1, which is why it deserves more weight. So again, this is a simulation. These are 2 studies that have exactly the same sample size, so 100 each in each arm. Also, the effect is the same again. So you have a 50% reduction in mortality or whatever the outcome of interest is. However, you'll see here that study 2 again gets double the weight. And why is that? Because it has more number of events. So 20 here and 10 here, and 40 and 20 in the control arm, you can see here. So the second thing it depends on is the event rate. So there are 2 things so the answer to Dr. Nirupma's question, that when you assign weights to study, the first thing it depends on is the sample size, and the second thing it depends on is the number of events. In order to answer Dr. Sareen's question, and this is the last part of the presentation, I will tell you a story. So this was a story of dealing with students' complaints. The student union wrote to the dean of the college that there has been a problem with the examination results. Some students who failed were actually good, and some students who passed were not good at all. So the dean appoints a committee to examine whether there is really a need to investigate this And if so, then investigate the problem. So this is the overview of the examination. It had 3 components: written, practical, and oral. And each of these components had 100 marks each, right? And the pass marks was 50% of the total overall. So 300 marks and 50% was the pass marks. So what the committee saw was that the results, the pattern, so the results of student, it falls into 4 patterns. 4 kinds of patterns the results of the students fell into. The first pattern, which was true for 165 students, you can see here that the written had around 55 marks. They got around 55 marks in written, around 60 in practical, and around 65 in oral. The pattern 2, which was true for 10 students, they got around 15 in written, 70 in practical, and 80 in oral. Pattern 3, this was true for 20 students. They got around 40 in written, 45 in practical, and 35 in oral. And pattern 4, which was true for 5 students, they got 90 in written, 20 in practical, and 25 in oral. So my question to you is, which of these patterns would you want to investigate further? Which of these raises a cause for concern? 2 and 4, right? Why? Why do you want to investigate it further? So the pattern 1 and 3 have around the same kind of marks in all the 3 assessments, whereas patterns 2 and 4, there's discrepancy, right? In fact, I had asked this question in one of the workshops for residents, and they had said that pattern 2 are all students of faculty, or all children of faculty members. So the patterns to investigate is pattern 2 and 4. And why is that? These patterns are unacceptable because marks are dissimilar across various evaluations, right? So it's acceptable when marks are similar. So another word for similarity is homogeneity, and dissimilarity, conversely, is heterogeneity, right? So in a systematic review and a meta-analysis, we don't want to combine apples and oranges, and so we are comfortable when the results are similar across different evaluations. So a meta-analysis is a study of studies, right? We're combining the results of different studies on the same topic, and it's nothing but taking out an average. And we are comfortable when there is homogeneity across the studies. If there is heterogeneity, we need to investigate. How do you identify heterogeneity? And there are 2 very simple methods. It's nothing technical at all. The first is eyeballing, by just looking at the forest plot. Just take a look at the forest plot and that will tell you, I'll tell you what to look for. And the other is a statistic called the I-square statistic. So if you just simply look at the forest plot, can you tell me which of these, and I'll wrap up in 1 minute, which of these is tells you about heterogeneity? This one, right? Because what are you looking at? You're looking at the overlap of the confidence interval and the closeness of the point estimates, and that's exactly what you look for. And the other thing that you look for is the I-square statistic, which is actually on a continuum from 0 to 100, and at 50% we begin to get concerned, right? So I won't tell you in detail what the cutoffs, etc. are, but just to tell you, this is a meta-analysis. Are you happy with the heterogeneity here? Just by looking at the forest plot, can you tell me if there's heterogeneity or not? No, there's no heterogeneity. We're happy with these results, right? So there's mostly overlap of the confidence interval and the point estimates are close by. What about here? Are we happy with these results? More or less, we are, right? So you can see here that just by looking at the forest plot, you told me you're happy with these results, and the I-square is also 0%, right? So those are the 2 things to look for in heterogeneity. Here also it's pretty much acceptable, because here you have again 36%, which is not much. Arbitrary cutoff is 50%. So but what you look for is the I-square and the forest plot. So I'll wrap up here by just telling you that there are softwares that you can utilize for each step of the systematic review. So you have softwares for screening, for data abstraction, meta-analysis, and for making the grade profile. And we in the Department of Epidemiology are happy to train you or to help you with any of these softwares. In fact, we'll be happy to help you with the syntheses if you're doing a systematic review also. And let me summarize that in a systematic review, you must do a thorough search, data abstraction by 2 reviewers, risk of bias assessment, syntheses, and you assess heterogeneity. And before I invite questions, let me tell you that we are doing a workshop on a related topic that's going from syntheses to guideline recommendations on the dates mentioned here, and it's in hybrid mode. The main attraction is that one of the most highly cited physicians in the world, Dr. Gayat, will be teaching at the workshop. He has an H-index of 296 and more than 400,000 citations. He's the co-founder of the GRADE working group. Other faculty from AIMS, New Delhi and PGI Chandigarh, besides myself, will also be teaching, and the registration link will be circulated through academics. Thank you.